From time immemorial, humans have faced pain, have tried to combat it in different ways. From using leeches to laparoscopies, we have always found a way to endure. But what if the very painkillers that help you function each day start hurting you? I am Dr. Arun Kumar V. I am a consultant psychiatrist with the Kadabams Group based in Bangalore. Fortwin 30 or Pentazocine is an opioid analgesic that relieves pain. It is used only in extreme situations and is to be consumed only as a medical professional prescribes it. Fortwin is an opioid analgesic. Like all opioids, it's highly addictive. To combat the addictive nature of Fortwin, it is usually combined with naloxone. Naloxone combats the narcotic effects of Fortwin and prevents you from getting high. Think of naloxone as the one sober friend in your group who drives you back home safely after a night of partying. Individuals who develop a dependency on Fortwin usually do so when they use the drug for a long period to relieve pain. Further, crushing the oral medication can render the naloxone ineffective. Addiction to Fortwin is usually identifiable if you observe the person closely. The person may start showing a sudden drop in productivity, and they may start isolating themselves from social situations. Since Fortwin is also an injectable substance, you could also look out for bruises or injection marks on the body. It's usually time to take stock when the person starts having sudden mood swings or breathing difficulties. When the substance starts causing hallucinations, well, the alarm bells should have started ringing long ago. Good and evil are two sides of the same coin. Sounds melodramatic, but here it's very apt. Addiction to Fortwin turns the once beneficial substance into a major threat to a person's life. It increases the chances of cardiovascular disorders, causes chronic breathing difficulties, and could lead to strokes as well. It also damages a person's mental well-being and can lead to multiple mental health disorders. Broken relationships, failing physical and mental health, decreased productivity, and so much more. The anatomy of addiction is not a pretty sight. Can Fortwin addiction be treated? Yes, they can be. That's the simple answer. However, the most comprehensive explanation is more complicated. Quitting cold turkey or without supervision is not advisable because withdrawal symptoms can crop up. Withdrawal symptoms could include insomnia, nausea, flu-like symptoms, and in some cases, seizures as well. So the first step is to seek professional help. This could be with a psychiatrist or a clinical psychologist. Treating Fortwin addiction needs a combination of medications, therapy, and support from family and friends. But with effort, the right treatment, and pursuing long-term recovery, addiction can be overcome. Remember, too much of a good thing is not such a good thing after all.